morning and welcome. Today we're here to talk about a better way to affordable health care. For working and middle-class families, health care is anything but affordable. Cost growth is out of control. Premiums are often the size of a monthly mortgage payment. Drug prices are an enormous burden. Job losses caused by the pandemic have impacted health coverage. All these factors weigh down family budgets and eat into savings, leaving Connecticut families struggling to make ends meet. Now, more than ever, Connecticut families know how important quality and accessible health care is. But sadly, this is not the first time you have heard me speak about this issue or seen Connecticut Republicans call for action to make health care more affordable. Today is Groundhog Day, and it certainly feels like Groundhog Day. I felt like Bill Murray, quite frankly, standing here, as we again stand in this building under this dome demanding action on a plan that will reduce the growing healthcare costs and provide relief to middle-class Connecticut families. The promises of the Affordable Care Act to deliver affordable, quality, and accessible care to all people have not been delivered for far too many Connecticut families. Since the passage of the Affordable Care Act, healthcare has grown more and more expensive for our families. Health insurance premiums increased in Connecticut in almost every year since 2010, rising a total of $7,064, an increase of 47.4%. Connecticut's average insurance premium for a family coverage today is $21,952 a year, nearly the same cost of a brand new Honda Civic. Families need relief, and what we have here today is not working for far, far too many. But there is a better way. While Democrat Party proposals for a public option would upend the current healthcare system and replace it with a government-run healthcare payment system, the Senate Republican proposal works to ease burdens on working and middle-class families and to fix the current system so that you can keep your insurance, keep your doctor, and still get savings so everyone can afford quality health care. The plan we are presenting today and the call for action on will, number one, reduce health insurance premiums by up to 30% over the long term, and that's according to the Access Health CT's own analysis. Two, reduce healthcare cost growth through benchmarking. Three, tackle unfair practices that drive up the costs of prescription drugs by looking at pharmacy benefit managers, also known as PBMs, and the practice of spread pricing. Four, maximize pool purchasing for prescription drugs and healthcare supplies. And five, to increase transparency and data to drive costs down. Unlike Democrats' proposals we have seen in recent years, this plan does not tax middle-class families and does not threaten the 48,500 quality private sector insurance jobs in our state. Our proposal also maintains the protections guaranteed under the Affordable Care Act, something the Democrat public option government-run healthcare system fails to do. The solutions that we propose make Connecticut more affordable for working and middle-class families and increase access to health care while supporting good-paying jobs. It is a better way to both a more affordable and a healthy Connecticut. At this point, I'd like to introduce our ranking senator on the Insurance Committee, Senator Tony Wong, to discuss some of the proposals contained in our plan. Senator?
Thank you, Senator Kelly, and it's great to be back in this building. And And I'm so excited in a week that we will be able to get back to doing the work of representing the people of Connecticut. And in light of COVID, health insurance and healthcare has come to the forefront. It is important for us to address this issue. I will present two major components that will reduce premium costs over the long term and rein in the out-of-control growth of our healthcare costs. They are reinsurance and benchmarking. These are issues that have been raised, that have been discussed, and in some form adopted in a tentative way by this legislature. What we're asking for in this legislative session is to codify it and to strengthen it and pursue it with conviction to reduce cost for our healthcare consumers. Reinsurance is a proven way to defray healthcare cost. It's utilizing the available federal funds as well as spreading out the risk and the cost of health insurance. It has been a proven vehicle in many insurance products throughout various industries. We have adopted in some way in discussions thanks to the leadership of Senator Kelly and many others, but I believe it is important for us now in this new session to codify it and to strengthen it and again pursue it with conviction. It is important to recognize that we can reduce healthcare insurance costs utilizing the federal funds and, in fact, if I may, according to Access Health Connecticut's own analysis, that in 2020's Wakely report, our proposal would drive down the cost of health insurance premium by 25 to 29.5%. That's an average saving of $6,475 per year, or $540 per month for each individual families and policyholders. These are real quantifiable savings for Connecticut homes that are struggling under the increasing cost of affordability in Connecticut. So reinsurance is critically important for us to pursue. Another factor is benchmarking. The governor has suggested in his executive order, we are looking to codify it into law so that, again, we can pursue with the same force, the same enthusiasm to implement these savings. The core goal of benchmarking is to gather information so that we can all work with the various shareholders and providers to shine a light on transparency and containment of cost comparabilities and produce better health care for cost at all sectors. And we have in Massachusetts, in 2012, they established their own growth benchmark work. The policy was designed to enhance transparency in the data metrics that I just talked about earlier. It's interesting to know that Massachusetts' initial implementation did not go perfectly, but ultimately it saved consumers over $5 billion from 2013 to 2016. So it has demonstrated it works, and we have the opportunity to be able to learn from the mistakes of Massachusetts to be able to implement another vehicle to contain cost. So ultimately, we need to take those two proposals that I'm addressing here that has been discussed, but we need to forcefully, as a legislative body, embrace it and implement it so that we can produce real savings for our consumers that are troubled by the increasing cost of unaffordable health care insurance. I'll give it back to Senator Kelly. Thank you very much for the opportunity to share these two particularly important viewpoints.
Thank you, Senator Wong. Now, in addition to those two, we have three more tools. The first issue we're going to look at is spread pricing. That's another proposal that needs focus, and it addresses the PBMs, which function as a middleman for the distribution of prescription drugs, in addition to managing pharmaceutical benefits for Medicare and Medicaid. What we want to do is examine the practice of spread pricing, which is when a PBM claims a higher reimbursement from a health plan than it reimburses a pharmacy for dispensing a drug. This results in the PBM extracting unnecessary payments from the payees, the taxpayers, and the patients. Connecticut has been a leader in banning gag clauses in PBM contracts that prevent pharmacists from sharing price information with their patients. We also banned clawback provisions. So now we must turn our attention to spread pricing to protect consumers from a practice that leads to more expensive prescription drugs. The next is maximize state purchasing pools to drive down costs. State purchasing pools for prescription drugs and healthcare supplies can leverage public buying power to reduce drug and supply costs. Connecticut must examine whether current pool purchasing agreements with other states are resulting in the most beneficial cost savings to Connecticut, and examine what other pools purchasing relationships can be explored to drive down costs of both prescription drugs and supplies like PPE. And lastly, in addition, we must look at transparency. Transparency through benchmarking and related data collection and access. Connecticut must also closely examine current health plans and ensure transparency comes with accountability. Therefore, our plan requires audits of the Cadillac health plans offered by the state, which are backstopped by the Connecticut taxpayer. The goal is to protect working and middle-class families and increase government transparency. At this point, I'd also like to recognize those who we have in attendance with us. We have, in addition to Senator Huang, I also have State Senator John Kissel with us, and in addition, Marcy Minnick, who is the owner-CEO of Excello Tools, a Milford business, and Julie Schubert, who is with Connecticut Healthcare Underwriters. She's the board and president of the Connecticut Benefit Brokers. So, just in conclusion, for far too long, Connecticut families have been promised affordable health care, and yet that has never been realized. And so Connecticut families have endured that for far too long. Now today is Groundhog Day. And yes, Chuckles, the groundhog in our state, saw his shadow and went back into the hole saying we're going to have a longer winter than we need to. And what we're hoping here with this proposal is that under this dome, the majority Democrats don't see their shadow, and that they realize that Connecticut families have been in the winter of high premiums and unaffordable health care for far too long, and that we actually get some results this session. It's not just a partisan issue. This is not Republicans or Democrats. This is for Connecticut families. They were promised affordable health care 8 years ago. Health care has been anything but affordable in the state of Connecticut. This initiative is long overdue, and it needs to be done for them. Question.